Well, hello everyone. Welcome to the fourth floor of Reform's offices in Westminster as we launch our new paper on the NHS workforce today. I'm joined by Kate Laycock and Maisie Borrows, authors of this excellent paper. Kate, what is it called?
The paper, Andrew, is called Getting into Shape, Delivering a Workforce for Integrated Care.
Getting into shape. Please tell us what are the key issues covered in this paper?
So the NHS should be looking to deliver as much care as it can in the community, and unfortunately at the moment the workforce isn't designed to do this. Delivering care in the community is both cheaper, but it's also often in the best interests of patients. At the moment what we see is 3 times as many doctors based in hospital as in the community, 4 times as many nurses based in hospital as in the community, and just 6% of hospital consultants are doing 1 or more sessions in the community each week.
We've also found that workforce planning is highly centralised. The Department of Health and its arm's length body Health Education England dictate the majority of training places. The commissioning of training places changes little year on year, and we found that workforce does not necessarily meet local demand. We've also found that the regulatory system is significantly flawed. It contributes to this silo model of care and is not necessarily based on patient risk. A number of regulatory bodies are looking at how they can use data more effectively to regulate based on risk.
So it seems to me what you're describing is a kind of old-fashioned approach to a medical workforce when the NHS is trying to modernise itself and evolve and so on. So what are the recommendations of this paper?
Yeah, exactly that. So the first thing is to devolve workforce planning, so devolve it to STP specifically. And this includes the commissioning of training places, terms and conditions and pay of staff. The second thing is that medical student places need to be uncapped, so that follows on from the uncapping of nurses and of pharmacists. And finally, the NHS needs to embrace all routes of training. So this includes flexible training routes and apprenticeships for all staff.
We also need to deregulate low-risk tasks, whilst also ensuring that proper performance management is in place for all staff groups.
Thank you. Well, this is a very radical overhaul that we're setting out in this paper. I think it's an excellent paper. It follows on from our detailed briefing work on the public sector workforce, our recent work on the police workforce. So I hope this is really a coherent body of work that Reform is setting out. Please read it. Thank you so much for watching.